Welcome back. If you are new here, I'm Chris and I'm a medical doctor and PhD candidate in epidemiology. And I'm also helping the healthcare professionals to relocate to another country. And we also have our own website, globaljob4you.info. We upload a lot of global healthcare vacancy, and during these days we have multiple vacancy from Singapore and Middle East country, especially for the clinicians. If your destination is Australia, working in Singapore is a strong evidence to strengthen your CV and getting a job offer. And Middle East countries are quite attractive because their pay scale or their benefit package is almost similar to the Australia's. And it's quite different from Australia. You don't need to pay income tax especially in UAE. So if you want to work as a physician in Singapore and Middle East country, please visit through our website Global Job for You, and you can work with us today. Today in this video, I'm gonna share you step-by-step and comprehensive information for Saudi residency trainings. Let's get into it. So I will provide a quick overview what happens and what next. So the first step is the submit for professional classifications in Mumaris. And the step 2 is you need to complete primary verifications, primary source of verifications, PSV. After getting or after receiving specialist committee for health specialty eligibility criteria, after your PSV process, you can book Prometric exam or Saudi medical licensing exam. And after passing the Prometric exam or Saudi medical licensing exam, you can prepare for your residency exam. So these are the 5 important steps when you want to apply residency trainings in Saudi. And I will explain a little bit about required documents before you do anything. So what are the documents you have to prepare? I would suggest you to provide the high quality color PDF if you prepare the documents. And these are the core and baseline documents you have to provide your PSV process. So the first one is the passport or passport page. And another one is your passport size photo. It should be recent passport size photo. And your degree certificates, your primary medical degree, MBBS or MD, and your transcript from university. It should be full academic transcript. And your internship certificates, and your national license from your home country, and good standing certificate and experience certificates. And if your name is changed at some point, you need to provide the name change certificate. And your up-to-date CV, and it must be contain your referees with content details. So these are the required documents if you want to proceed your residency training process. This is the DataFlow process, primary source of verification. So in this stage, why Saudi Commission for Health Specialty use DataFlow for the primary source of verifications. In this stage, they verify your degree, internship, your license, employment, your good standings, and other documents directly with the issuer. So after completing your PSV process, you will get Saudi Commission for Health Specialty eligibility, and you can book a Saudi medical licensing exam. So after Mumaris classifications, Saudi Commission for Health Specialty, they will issue you eligibility number. It's required to schedule for Prometric exam or Saudi medical licensing exam. So you must present this number when you book the exam. So book the exam through the Prometric channel. So you will know a lot of my YouTube channel. I already explained about the Prometric exam center. So Prometric exam centers are around the world, and you can check it out year by year. So what Prometric what Prometric Center will ask you for your booking process? They will ask you your eligibility numbers and your government issue ID used to register, like a national ID or your passport, something like that. So this is the required documents when you book your Saudi medical license exam or Prometric exam. So let's talk about Saudi medical license exam. So it's the same exam format like other Middle East country registrations exam, like Dubai registrations exam. But the number of questions can be different. In here, it consists of 200 MCQ, but in DHA, it consists of only 150 questions. So in here, they will include 20 pilot questions. It's a 4 hours MCQ exam, and you can have a break between 2 sections. In each section, you have to answer 100 questions with the 120 minutes per each part, and your break time will be 30 minutes. And MCQ have 4 options, from which the candidate will choose one best answer. So it's best of 5 questions, something like that. And another one is how many times you can sit this exam. So so they allow you to sit or to take the exam 4 times a year, starting from the first attempt to obtain a pass score. So you have 4 times per year. After passing your exam, you are not satisfied with your pass mark, so you can take another 2 attempts to improve your marks, because your mark in here is important for your residency exam selection. So it means that you can have a 6 time of attempt to get your perfect score, right? And how is the exam conduct? It's a computer-based testing with 2 sets. I already mentioned the exam time is 4 hours. So 200 multiple questions, and after what time or how will they announce your result? It will be 2 to 6 weeks of the end of your exam. And they will provide you a statement of result and feedback report on each sections. And what are the components of in this exam? They already mentioned the 4 sections: medicines, obstetrics and gynecology, pediatrics and surgery. So medicines is account for 30%, and obstetrics and gynecology is for 25%, pediatric for 25%, and surgery for 20%. So you have to prepare this exam thoroughly. I like this exam format because they have a very clear structure what they will ask you. I will explain to you a little bit about this exam format. In medicines, you have to, in medicine portions, it will include cardiology, pulmonary, gastroenterology and hepatology, nephrology, endocrine, rheumatology, hematology, and infectious disease, neurology, oncology, critical care, pediatrics, and psychiatry. So they have a different components. And pass score for the Saudi medical license exam, a panel recommended a pass score of 560 on the reporting scale of 200 to 800. So the selections for the residency pathway is depend on the pass score. So they allow you to retake the 2 attempts if you didn't certify your pass mark. So the selections is based on this score. They have a popular trainings, specialty trainings. The surgery and dermatology are very popular in the Middle East country. If you want to get into the surgical trainings, your pass score must be as high as possible. if you hit the 100% 800 score, you will be perfect, or you will be a super to be selected. So this exam score is important for the selections of residency. And the durations of the residency specialty is depend on what specialty you went to apply or you are getting into it. So for internal medicines, usually for 4 years, and surgery for 5 years, include rotations and on-call duties, in trainings evaluations, and in training promotions exam, like a part 1, part 2 exam for some specialty. After completely your residency durations, you have to sit sorting board final exam. It's a written MCQ exam as well, and additionally you have to take OSCE clinical exam. So after your 3 to 4 years trainings or 5-year trainings, you have to sit clinical exam and MCQ based exam. You have to prepare for both, and after completely these 2 exams, you will be a specialist in Saudi. So I hope this video will help you if you are finding residency trainings in some country. And I suggest you to take this pathway because this is very realistic, and Saudi medical licensing exam is not included. Clinical exam is quite flexible and comfortable to you. If you hit the high marks, you have chances to be selected. So see you in my next video.